So, I'm Dr. Talpaz, a professor of medicine at the University of Michigan, and I'm presenting here data from a phase 2 study of a JAK2 inhibitor from Sanofi Aventis. I took part in the phase 1 studies that was published in the Journal of Clinical Oncology about 2 years ago, I think. But this is an extension of that study, and it adds some very interesting dimension. This is a unique phase 2. It's a small phase 2 in 31 patients, but it allows 3 different patients were randomized to 3 different dose levels, 300, 400, and 500 milligrams given daily. And the message of this study, as far as activity, higher dose work better. As seen very nicely here in this waterfall plot, the highest dose here, 500 milligrams, 7 out of the 11 patients have more than 35% reduction in volume, and it's 12, and only 4 of those that got 400 and 3 of those that got 300 achieved the same level. So, granted, it's a small study and it needs to be confirmed in a much larger observation, but it suggests dose makes a difference. This is the first day level, and this is the cumulative levels. So, but more interestingly is the pharmacodynamics. The pharmacodynamics, the first one is the inhibition of the STAT pathway. You can see inhibition of STAT, which is directly related to the AUCs, to the area under the curve. Higher levels of the drug, better inhibition of STAT. This is degree of inhibition. And the red dot represents 2 hours, whereas the blue dot represents 24 hours, which means that the suppression happens by 2 hours, it recovers by 24 hours. So it's kind of nice, elegant, predictable. And perhaps this is interesting, again, it's in a small cohort, but there is relation between degree of suppression of STAT and response, which means we have perhaps a pharmacodynamic markers which says the more we suppress the STAT pathway, the better the response. So we have everything with a grain of salt. It's a small study. I don't want to read too much into it, but it's nevertheless interesting. It's nevertheless very, very interesting. We also looked at the suppression of a panel of 97 cytokines. And the statement of the company, which I disagree with, the company said the cytokines are suppressed, blue is suppression, red is increase. The company statement is it's suppressed across the board, and it's not a test that can identify responders from non-responders. But I think that there is an interesting cluster here among patients that didn't respond. So maybe we can identify some cytokines that fail to decline in resistant patients. To be seen, we need more information. Anyhow, the message is we have seen nice responses. The incidence of responses is unusually high. Here it is, if you look at the responses, we said 7 out 11 getting deep splenic response is higher than the numbers we are familiar with. It's a small study. The question is, will it be confirmed in a larger number? That's one message. Granted, with higher doses, there's also more nausea and vomiting, but it seems that these side effects tend to attenuate over time. And while they are a problem in the first cycle or 2, they seem to gradually dissipate with subsequent cycles. In other words, this drug is now going to prime time and is being assessed in a larger study which is randomized against control, placebo control, very similar to the studies that led to the approval of JAK2. And I'm expectant that, and hopeful that this will have the same fate.